People sometimes who have personality disorders will struggle with being able to maintain relationships, romantically and in a work environment as well. Antisocial personality disorder is typically a person who has a long-standing history of blatant disrespect and disregard for authority and rules. They are often charming, but when they're challenged, they can be really argumentative. Avoidant personality disorder would be someone who tends to shy away from other people, so they tend to be isolative and withdrawn. Borderline personality disorder tends to present with people who are highly sensitive to rejection. They often struggle with a firm, solid sense of who they are. Dependent personality disorder looks like someone who struggled doing things on their own. They struggle making independent decisions. They tend to require a lot of support from other people to kind of validate or affirm what it is they might feel or they might believe. Histrionic personality disorder is typically extreme reactions and responses to situations and circumstances that seem to be out of proportion, and this is a way in which that they keep themselves at the center of attention to get the support that they feel that they need, and this is the way in which that they go about it. Narcissistic personality disorder is a pattern of not being able to see situations outside of yourself. There's a bit of overinflated sense of self, an overinflated sense of abilities that they might have. Obsessive compulsive personality disorder looks like someone who is preoccupied with perfectionism, order, structure in a way that makes it hard for them to pivot, and when they are forced to, it creates a lot of distress. Paranoid personality disorder is someone who has just this long-standing, pervasive struggle with trusting other people and situations. Schizoid personality disorder is someone who doesn't have a desire to be around other people. They want to be isolated. There's not the distress, it's just their preference. Whereas schizotypal personality is more of when we think about people who might be quirky. They might have different ways of expressing themselves. They may have different ways in which they use language. They sometimes can be a little bit more disorganized, but not to the point where it really interferes and impacts their functioning. There is no psychosis. There's no hallucinations. There's no delusions. They're just a little bit different from how we typically see people engaging. If you think yourself or a loved one is having signs of a personality disorder, the best thing to do is to seek counsel, and whether that is starting with your primary care provider or if you already have someone who supports you through mental health, talking to them about it. The key is really going to be trying to determine if there is suffering and impairment and functioning in terms of whether there needs to be an intervention or not.